Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is health equity and Medicare Advantage. My co-host and moderator of the chat, Dr. Dan McCarter. Dr. Dan, welcome.
Hey, Faisel. It's great to be here again.
It's great to be back. We took off last week. You had a wonderful wedding in your family. You're out in Colorado.
That's right. It was a great week. It was a lot of work, but a great week.
It's great to be back over here. And I'm so thrilled about tonight's friend who's joining us. We have Congresswoman Schwartz. Congresswoman Schwartz, welcome to the show.
I'm delighted to be with you.
It is so great to have you on. Obviously we're very passionate about Medicare Advantage. As ChenMed, we take on full risk in the Medicare Advantage space, and we exist in the same neighborhoods as really the federally qualified health centers and really the public health departments. And that's my background. My background prior to joining ChenMed was from a large federally qualified health center in Florida, and I've witnessed the worst of the fee-for-service system. What happens to people who don't have any insurance? What happens to people who can't afford their copays or their deductibles? And then we come I joined ChenMed, and I'm in the same neighborhoods as the FQHCs, with the outcomes that are some of the best outcomes. I never even knew those types of outcomes were even possible. So I'd like to ask you about Medicare Advantage and health equity, increasing access to care through Medicare Advantage. So especially for the medical students, the residents who are listening who may not understand some of the history, if you could give an introduction to that first.
Absolutely. But first, let me say I'm delighted to be on. Faisel, you've been a wonderful supporter of Medicare Advantage. The work you do has been an example of leadership in how you redirect healthcare dollars to primary care and to managed care and to patient-centered care. And I've been to visit ChenMed Center in Florida. It was a great visit, and it is just an incredible example. And I know as the work I've done since Congress of the Better Medicare Alliance has really been about how do we tell the story of what's really happening in healthcare today. And I come at this from many years ago, having worked for a fledgling HMO when they were just beginning, or at least a second stage, maybe second generation. And we all thought, at least I did then, so I feel like I've come around to it through many different things in between, the fact that we have to center our healthcare around primary care. We have to center it around a primary care team that can help patients be able to manage their chronic conditions. It doesn't mean we don't need hospitals for acute care, for episodes of care. We want excellence in that care. We deserve that. But in between, what we're really dealing with, particularly for seniors and those on Medicare, is multiple chronic conditions. And that's where the big expense is. You know, we always hear about that expensive case that happened. It's really the ongoing care for people with multiple chronic conditions who are trying to juggle a very fragmented fee-for-service system. And sometimes can't follow the instructions. Sometimes they don't have access to the kind of care they need. They don't have the family supports. They don't have access to transportation. ChenMed provides that. And so I've been working on and advocating for Medicare Advantage. And I do believe it's just an extraordinary example of when you create a different financial system where you're paying health plans who do their part in terms of the actuarial analysis of what benefits you can provide and how much it costs and how do you reorganize healthcare, and with providers who are taking risk, as ChenMed does, and really saying we have to transform way we're providing care. The focus has to be on care for the individual over time, help them manage their conditions and understand their circumstances, even beyond the clinical ones. So Medicare Advantage has been able to do that. They've been able to lower premiums, lower costs for consumers. Everyone in Washington, every congressperson says that's what they want to do. But they also work really hard to keep people out of the hospital and out of expensive settings of care and repurpose that money towards primary care. And that is a huge difference. And again, in managing the care and care management. So, we've seen, so that's what Medicare Advantage is. It's actually been around for 20 years. It was originally put into law under President Clinton. Many people identify it with President Bush the first. And in fact, that's not true. Bush the second, but, just it actually started under Bill Clinton. And the idea was that for the same amount of money, or potentially even less, but for the same amount of money as fee-for-service, we could be doing a better job for patients, better outcomes and better cost and better benefits. And in fact, here we are in 2021, and we've seen premiums incredibly low. We see almost half of Medicare Advantage beneficiaries not paying anything in premium. There's saving money in terms of co-pays. We did a report, we do one every year. Last year it was over $1,600 in savings over fee-for-service, and you get better benefits. The traditional ones are that are allowed to be added under Medicare Advantage. If they can save the money, they can add extra benefits. You're talking about some dental, vision, hearing, and wellness programs. And now, just in the last 2 years, they can do something traditional Medicare, fee-for-service Medicare can't, which is to say, you can target certain populations with chronic conditions and provide even them with more care and different kind of care, like transportation and like maybe care in the home, or actually there's some doing pest control. And we're seeing enormous growth in those kinds of areas about what really works. So we can talk about that, and it's been extraordinary. I'll close this beginning is to say to your audience, what's interesting is Medicare Advantage is a choice that individuals make who are enrolling in Medicare. And so you can choose to get your benefits through traditional fee-for-service or through managed care option of a Medicare Advantage plan. And this is voluntary. And we're seeing overall people who have all, Medicare, 42% are choosing Medicare Advantage. And if you look at just the people who have Medicare Part A, which is the hospitalization, and Part B, which is the provider side of paying, which is a smaller group, because some people have just the hospital and still are working or have other retirement benefits, it's 49% of beneficiaries are choosing Medicare Advantage. So beneficiaries are understanding the value this has for them. And we can talk more about how providers are seeing it as well.
Wow. What a great overview. And it makes sense. It makes sense. We need to move away from primary care being delivered in all the wrong places. It's like what's that? Looking for love in all the wrong places. Like, we're looking for primary care in all the wrong places. We have primary care being delivered with specialists. You have specialists are doing basic primary care workup because they're not being done in a primary care office, and you have primary care being delivered even in the emergency room setting. So what you're advocating for is a shift away from the hospitals and away from the unnecessary hospitalizations and unnecessary specialty referrals, and back towards a system that's based on a good foundation of primary care.
Right. I mean, I'm old enough to remember my general practitioner, we used to call it then, down the street, who knew me and my family. And actually, I have 3 siblings, and one of them is just 12 months younger. And he sort of thought, I can look at either of you and I'll figure out what's wrong with you, which wasn't quite right. But he sort of had the point. But he knew us well enough to know what we could handle and what we couldn't, and my family. And it's, there are wonderful things about today's medicine, but one of them that we need to get back to is, how do you actually have that kind of family doctor?
Yeah, could you imagine that general practitioner with today's technology?
But exactly. Oh, we could talk about this. Technology is amazing. Yeah, exactly. Look what happened during COVID. The use of telehealth, which Medicare Advantage, again, was ahead of the curve on. They were using more telehealth, and it really, we believe, I think ChenMed has told me, you believe you've saved lives because you got people the care they needed. You reached out to them. You were bringing them tablets so they could talk to their primary care physician. You got them the ear when you needed to, but you kept them out of settings of care to keep them safe, and you got them the care they needed. And the sense of security and less sense of isolation that so many seniors and Medicare beneficiaries experience. We all experience that sense of isolation, but for somebody who is really living alone, who really needs help, that social isolation can have dramatic impact on your healthcare and your well-being.